the DMed. So I get on the computer and have access to it, and I start plugging in ICD codes. And the numbers are just unreal. So I call Lieutenant Colonel Pete Chambers.
My name is Pete Constantine Chambers, retired Lieutenant Colonel, United States Army Special Operations. I was also a flight surgeon with the United States Army Green Berets. When I lost the ability to go to my command, I went to a congressman. I went to 2 congressmen. I went to 3. Nobody wanted to talk about it until finally Senator Johnson came forward and said, I'm looking for whistleblowers. And I had been talking to Dr. Teresa Long, a Lieutenant Colonel, flight surgeon out of Fort Rucker, Alabama, and she said, look at the DMed data, Defense Medical Epidemiology Database. Look at that data. I pulled up the DMed data and went, whoa, neurologic events up 1,100% since the shots rolled out. 11x rise.
Not found a rate of transverse myelitis, for instance, that is higher than would be expected in the population.
So this is transverse myelitis. So essentially 2021 had as many cases as the preceding 4 or 5 years before it.
That's the main part of defining a safety signal. Is it out of the ordinary?
I don't have the data to be able to make a connection yet.
The average number of adverse event reports to VAERS over the past 30 years for all vaccines combined is 39,000, more or less. Compare that to over 700,000 reports. You don't have to consider it to see a deplorable safety profile.
There's a database that exists in the government realm called the Social Security Administration Death Master File. And this file has roughly 90 million records in it. And it captures 85 to 90% of deaths in the United States. So what I did was compare each month for the prior 5 years.
For these mRNA vaccines, there is incredible BS out there about like thousands of people dying, etc. That just ain't true.
We are seeing right now the highest death rates we have ever seen in the history of this business. It's not just at One America. The data is consistent across every player in that business.
When comparing the DMed data to VAERS and to other data banks around the world, to include actuaries from insurance companies, when you compare those, they virtually line up the same.
I don't want to think that these things are so dangerous that they're causing this much excess and injuries in my fellow people. But it really, really looks like that's